Jenny here. 1 year ago today, April 5th, I had my first chemotherapy appointment. So today I thought I would make a video on all the side effects that I had from chemotherapy. So just kind of one video with a compilation of everything that I experienced through my whole 8 treatments. So for those of you that are new here, just finding my video and joining in, I'm Jenny. I am 57 years old, and as I said, 1 year ago in February I went to the doctor as I was having symptoms of what I felt were hemorrhoids, and regular pain reliever wasn't taking care of the pain, so I thought it was finally time to go in. Granted, I was having symptoms for a whole year or two before that of lots of gas, having to go to the bathroom every 2 hours, having not really formed stools a lot, and things like that. There's another video on that if you want to see that whole story. But I was thinking that it was more of like a gluten intolerance, or I had some kind of intestinal bug or something like that. So I was trying to treat it all myself and everything, but then it got to the point of that I was in too much pain and pain relievers weren't helping. So I went to the doctor, found out I did have a cancerous tumor in my rectum. And so that started the whole process then of having a colonoscopy, having a port put in. So I still have that at this point in time, right there. So I do have the port for getting the chemotherapy treatments, also for being able to draw blood and things like that. So that made that a lot easier. What else? Then I got an ileostomy bag because of where the tumor was. The tumor was up against the vaginal wall, and they didn't want the combination of chemotherapy and or more so radiation perforating any walls, and so they gave me an ileostomy bag right away so that I would be safe that way, which in hindsight was really a godsend to have that I didn't have a lot of the problems other people were having. So there's that. I have notes. I wrote up some things that I went onto a website called healthline.com. I looked up FOLFOX Chemotherapy so that I would have some of the right notes of what the stuff I was going through and all the symptoms, and I'll let you know whether I had those side effects or not. So as I said, I had the colonoscopy, the port put in, the ileostomy, and a CT scan and an MRI. And through all those testings, I was diagnosed with stage 3 adenocarcinoma with no spread to the organs, and they weren't sure about the lymph nodes. There were 1 or 2 that looked a little bit bigger, so they weren't sure, wouldn't know until obviously they get in there and actually do a biopsy or remove them, which my surgery didn't happen until December because my tumor was about 9 centimeters by 4 centimeters, which is about 3.5 centimeters by like 1.5. So that was larger than they really wanted to operate on at that time. So that's why they went ahead and did the chemotherapy first. Again, this is my whole experience. This is what I went through. Other people have had different experiences. So sometimes people end up in the emergency room with a blockage or something, or there is an emergency and they need to do surgery first. I think that's usually it. Usually when they go to the doctor, it's a matter of more so an emergency of why they do the surgery first. Otherwise, they usually try to do chemo first and shrink the tumor. Mine was also close to the sphincter muscle, so I think too they were hoping that the tumor would shrink by half. And so again, it would be easier to operate, and they were in hopes of reversing the ileostomy to be able to reconnect me so I would still have the whole normal intestinal process. So again, they wanted that tumor to shrink. The oncologist said that they wanted me to have at least 6 treatments. At minimum, 8 was the maximum. That's what they were, it's kind of a normal treatment. So as I said, I had what's called FOLFOX, F-O-L-F-O-X. It's an IV drip, and it goes through either a port or some people have a PICC line. I ended up with a PICC line in the hospital when I had a blockage, so it's one that they put in your arm, and they find another vein that they can get where they put a line through that also goes up and over and down through to your heart, which the port line also does that. It has a little line, you can kind of tell it goes up my neck and goes in and down to the heart. The PICC line has stuff that kind of hangs out. You have to make sure that you're always covering it. It can't get wet, so when you're going in the shower and things like that. But they are both good options for getting your chemotherapy. I don't think I was given an option for a PICC line. I think they just said I'd get the port. And I think at least most people here, like in the United States that I know of, get a port. So the FOLFOX, what that contains is leucovorin, fluorosil, and oxaliplatin. So the combination of these medicines, what that does, it stops the cancer cells from replicating. So it can also kill healthy cells that divide rapidly, like hair follicles, gastrointestinal tract, and skin cells. It is done in a treatment room. So again, different places have different types of treatment rooms. Mine was like a big open area, and it kind of had 3 different bays. In each bay there were 6 chairs, so a big honking comfy, like oversized stuffed chair. And it's done through an IV drip. So again, they do, when I first got there to the appointment, they would take blood work from me. So they would put a big needle type thing in the port, and it's almost kind of like a thumbtack type of a something. They put the needle part in there, and then it has the tubing that comes out. So they take the blood work from there, they leave that in you. You go and see the doctor and see what your results are from the blood work. Sometimes the white blood cell count's too low. Sometimes other numbers may be off and they may not be able to give you a treatment. And then you have to like wait a week or something like that. Otherwise, if everything looks good, you talk to your doctor about all your symptoms or anything going on and how you're feeling, then you go to the treatment room and then they start with the IV drip. You also just wear comfortable clothes. So anything you want. I usually try to wear a V-neck type shirt or something. It was nice that I was going towards summer, so it was good. I didn't really need a lot of warm clothes or a lot of layers. So again, they have easy access to the port, because the other thing is that for my treatment, what happened was that port stayed in then also for the next couple days. My treatments were on Wednesdays, and then I went home with a pump, and that was removed on Fridays. So I had that needle thing sticking in there for a couple days, so I didn't like having anything really rub against it or that. So it was good to have something nice and comfortable. Again, you don't need to get into a hospital gown, you don't need to change out anything and stuff, which is nice. You just wear your normal street clothes. So from that site that I mentioned before, they had mentioned in there that research has found that FOLFOX may offer benefits for people with stage 3 colon cancer when they receive at least 8 cycles of treatment. Each cycle is 2 weeks. So as I mentioned, my doctor had wanted that 8 weeks. And each cycle being 2 weeks, as in you go in the one day, you get your IV drip, and then you go home with the pump for a couple days, because it takes like 22 hours for that medicine. Then you go back in, you get the pump taken off you, and they take the needle out, and then you wait another 2 weeks before your next treatment. So make sure I covered everything in here, because I'm kind of jumping around, I see in my notes. But yeah, so my process took around 3.5, 4 hours. So as I said, I would get there early in the morning. I think they try to do that with a lot of the chemotherapy type patients. Have them come in the morning. So I was there around 8:15 in the morning to go back, get that blood work. And then I would wait a little bit till I was called back to see the doctor. So like I said, the doctor would ask different questions. I usually came in, me being me, I came in with my piece of paper and I had all my notes on there as to what happened, like day by day. I'm like, this day I had these symptoms, this day I felt this day I was doing this day I felt better, and that was good. So he found that kind of funny, but he appreciated it. So when I gave it to him, he could use that for notes later, and I thought, you know, I don't know, do it for research later too, again, for different patients that you know. And, you know, in case you forget what they really said or something, and you've got it all spelled out for you right there, that this is maybe how treatment can go for some people, you know, for each treatment or day by day or how the week goes. So yeah. So you visit with the oncologist, like I said, get your blood results and stuff, and then go for the infusion. Now for me, again, first they gave me a bag of anti-nausea meds. So they hooked that up. Let that go through. That took 30 minutes. So whether, you know, if that helped or not, it did. I did not experience nausea really at all through all my treatments, which was I'm very grateful for, because that's a big thing. The major thing I was really worried about was that I didn't want to be throwing up for a day or two afterwards. So I did not have that. So again, I got the anti-nausea meds, so that was nice. Then they started the FOLFOX infusion. Now again, also seeing your doctor, seeing the blood work, the FOLFOX medicine is also mixed up kind of per person. I think it also goes by your weight and all that stuff. So it's all individually mixed. Part of the waiting time and the treatment time was waiting for the pharmacist to mix up that medicine. Now in this oncology floor, at least in my office, the one I went to, they had their own pharmacist. They had their own lab. So where I got the blood work done, they had, the lab was all right there, and then the pharmacist was right there. So again, they just, the nurses didn't have to go anywhere else. They did whatever. It was all right there. So they got the bag of medicine, and that took 80 minutes. So I know there was only one time. Usually the medicine was ready fairly quickly. Again, they know the patients that are coming in. They still have to wait for the blood work to be done and the doctor to put in the order. But at least they have a clue kind of how many patients they're going to have, how much they need. There were, I know, 2 pharmacists at the beginning when I guess I first started my treatment, and then towards the end, the one pharmacist had left, or they had transferred her somewhere else. They had 1 pharmacist, and so it was taking a lot longer to get the meds to come out. And at one time, I think I had to wait an hour before my medicine was ready. So thank goodness that only happened once for me and for others, which I know other people were kind of complaining. I'm like, these poor nurses, they were fantastic. They were wonderful. They understood all this stuff. They understood if people were upset and whatever, and they would just try to very, calmly tell them, sorry, this is what's going on. We get it, I understand. But, there wasn't anything they could really do about it. It was just, please have patience. Or they would thank me because I wouldn't say anything. I'm like, whatever, I'm here, I'm hanging. This is what I'm doing for the day. I don't have anywhere else to be because, you didn't know if there'd be a glitch if something would happen, and didn't schedule anything else for those days. And so they'd be like, oh, thank you so much for your patience that, I'm so sorry this is taking so long. But, I'm like, yeah, that's okay. I get it. It's, when you get it, you get it. And then I sit there while the IV drips and usually go to the bathroom a couple times. And so take your IV pole with you, get into the bathroom. That's about it. Sit there, I'd be on my computer. My husband sat there with me. He was usually doing work, which is nice. He could do that from home on his computer, which then he did also for the rest of the day. He would stay with me. And I had my computer to, check up on Facebook, watch some YouTube videos, keep myself occupied. Some people would sleep. There was a curtain you could pull around your unit if you wanted to, if you didn't want anybody seeing you, if you wanted it quiet, you wanted to sleep, whatever. I always had it open. I like to watch around, see what other people had going on. Same thing, see if anybody else was doing the same as I was. Again, also a learning experience to, again, see what's going on, to see if that was something that I'd end up doing or having. Or so after that medicine went through, then I would get a shot of Fluorosil, and then they would hook up the pump for Fluorosil. Different people have different types of pumps. I had one that I kind of was like in a fanny pack type of thing that I could wear, over the shoulder, or like, a little purse. The pump unit was probably about as big as my hand. It had a screen on there which could tell you if you, hit a button that how much time was left and whatever. And obviously they programmed in there how fast it would go. So that would pump the medicine out, which would go in me. And then I would just wear it. I think I would wear it more around my waist because, or I could wear it up and down on the side. I have my port on the side, so I didn't want to wear it like crossways, because it would hit the port, and even wearing it up and down. I also have my bag on this side, so I didn't want it hitting my bag. But I think I wore it around my stomach, and I wore it up kind of high, so, or kind of more on an angle, but up high, so it wouldn't affect my bag or be kind of the top. And at nighttime, I would just have it lay there and be by my side and sleep. I just slept on the couch. It was easier for me to deal with all that, and I didn't know how much I'd be rolling around, how much I'd be sleeping, so I wouldn't disturb my husband. That all went fine. So as far as side effects, again, for me, it was really strange in that even starting with the very first infusion, when I was getting the medicine, towards the end of it, I was getting this really full feeling. I could feel, to the top of my stomach. It kind of felt like, like gas, like what, but I couldn't burp. And I was just like, oh man, how much more I can take. I know by the second treatment, I know it had happened again. I tried a gas X pill, didn't really help. I tried, what else was there? I tried something else that they had mentioned. Oh shoot, now I forget what. But I tried walking around. So when that was full, as I said too, you can walk around if you want to, but nobody else was really doing it. So I didn't really want to be the only one with a little IV pole pacing up and down the little corridor. The day that I had to wait an hour for my medicine, that day I paced, because on that day I actually had hand cramping. So again, let me go in order, I suppose. So the first day, you know, for every treatment in reality, I had that full feeling. By the end, what I found out to kind of help compensate for that or get rid of it was that I would move around and do little chair dancing, that I would just start, you know, moving, bending, because it did seem like more like gas. If I burped, I'd feel a little better. I didn't hear, you know, the nurses said they didn't have anybody else that had that happen to. Prilosec. Prilosec was the other thing that the nurse had mentioned. But I think maybe I thought that Gas X would be about the same as that. So I don't know as though I tried Prilosec. Because again, the nurses had said that they had that happen with someone else. I forget what kind of treatment they were having, so to try that. But yeah, the only thing that helped me was just moving around a lot. If I kind of felt a little bit or I felt it start, then I would start moving around. And it usually was only, like I said, the last 15-20 minutes of that 80 minutes. So not too bad. And then for that first day, again, I was fine until as we were leaving and we were walking to the car, from the facility to the car outside. It was April, so it was a little cool, a little windy. You know, it wasn't cold, but having it be a little windy, I could feel the tingles in my face a little bit, in my nose. When I was breathing, I could feel it in my nose, I could feel it in my fingers. So we got in the car, the sun had been shining in the car, it was nice and warm, and that kind of took all that away. It was like, oh, that was nice. But after that, I remember even for those first couple days, I wasn't feeling the best. I think I was kind of okay for the first infusion and when we were home and we took a walk, but I had to have a scarf on because I would feel it in my nose. It was like 50 degrees, which normally, you know, being up here at 50 degrees isn't so bad, and the sun's shining, you can kind of walk outside like with what I'm wearing right now, or wear just a little light coat. And I was bundled up. I had a hat on, I had a scarf on, I had mittens on because of that effect. So I had that. So the cold weather, yeah, made me feel that. I didn't really have much of an appetite for the first couple days. And again, and this kind of happened for every treatment, I would end up getting the finger tingles and a little bit in my toes. I had first bite syndrome, so that's when you take a bite of something and your mouth just kind of explodes in little tingles. So if I would chew on this side, all the, you know, it would just be like, you know, it was like, oh, okay. And then take a couple bites and then it would calm down. It was fine. And then when I realized that that would be happening, and just lukewarm food, even warm food, it didn't matter. I would then make sure that I would also eat on the other side for my second bite and have that kind of do its thing. And then it was done. Then I was fine and I could eat and everything was good. With cold things, I think I tried some ice cream. One of the, you know, the first infusion or second infusion, first couple days, I tried some ice cream and it just felt like broken glass going all the way down. And then same that was happening with water, even room temperature water. I know that as I said, you know, have things room temperature. I couldn't even drink my water room temperature. I actually had to heat it up in the microwave for about 30 seconds. So again, it just felt like that broken glass. And again, that also lasted for about 5-6 days. Towards the end of that time, that second week right before my next infusion, then I could have a little bit of the cold water, room temperature water. I was fine. The first bite syndrome and all that also only lasted for those first couple days. And then again, I was fine. So it's always, you know, then you're feeling fine and then you're like, oh, I gotta go for another infusion. And then you know you're gonna have these couple days of symptoms, which again, for me, it was like, I knew what I was getting, you know, was getting into, what I was going to have. And I knew I could tolerate it, but it still was just kind of like that, ugh. You don't want to, but you know you have to. But again, at least my symptoms really weren't horrendous, that again I could make it through. Not that I wasn't sad and all that. I had my days of lots of tears and just having to get through it. And again, the whole, just thinking about the whole thing, thinking that you have the cancer, thinking about life, thinking about, it's just a whole mental game too. So what else? But by the second, third treatment, I couldn't touch cold items in the fridge. They talked about that might be a thing and happen, and it did. So if we were grocery shopping, I couldn't, in the cold areas, like I couldn't get the frozen vegetables out, or I have to wear gloves. And then I could touch that stuff to get it in the cart. And at home here, same, to grab stuff out of the fridge. I bought some gloves, some cotton gloves, that helped, so I would wear those to get things out of the refrigerator, or to like cut up some strawberries or cut up stuff that I could hold on to, whatever, with my mitten hand. And then I was tired. I wasn't really exhausted per se. I didn't like, there was maybe a time or two throughout the whole thing that I felt exhausted, but for most I was just tired. But I was tired. I wasn't exhausted, but I was tired enough that I didn't feel like really taking walks. The two things that a lot of people mention are move, make sure that you're moving, taking a lot of walks, and drinking a lot to flush your system. Both. Walking helps the movement, helps the body, you know, the fluids move and process. Drinking a lot helps flush everything out. So you want to try to help flush out this medicine. Again, keep it moving, keep it going. And those are both things that was just kind of like, you know, I didn't have the energy to walk. As I tried first couple times, we would, you know, try to walk, but it would take me till about Monday. From Friday when I'd get the pump off until Monday, it was just like, you know, I'm tired, don't really feel like eating. You know, I just want to rest and lay here. Usually I would take a nap. Some days not. I would just still sit there and rest and read and whatever. Watch some, I didn't watch. I watched YouTube. I had my laptop on. I have a couch that had a footrest, and I put the computer on there, and I would watch some videos and catch up on stuff that way. What else? Diarrhea. I had that. And so again, that's also why I'm saying I was grateful that I actually had the ileostomy, because I had a lot of watery output. And so for me, it was a matter of, well, then I would just empty my bag. So again, even part of being at the clinic, sometimes when I would be going there, my bag would fill up and I could empty it. Like people that don't have the bag, I know they still have diarrhea, and then it's wiping the butt a lot, and then they get a really raw, you know, sore butt and have to deal with that. So the bag was a blessing. I didn't have any pain in the butt area. I didn't have stuff coming out that way. Yeah, and then nausea. Again, I had the first treatment or two, I think I kind of felt nauseous, like the first day-ish or that when we first got home. But also, I don't know, it also could have been that I was low on electrolytes, that I was kind of dehydrated. So we tried different drinks with that, with Gatorade and Propel and something else. So I think we went to the liquid IV. We'd heard about that. The nutritionist, I think, mentioned liquid IV and something else. So tried some of those fluids, getting the liquid IV worked. That I could drink like room temperature. That didn't need to be warmed up or anything. So that was also interesting. But I also had been given prescription nausea pills. So I had ondansetron and prochlorperazine. So after my pump was removed, I was supposed to take one of these pills on a Saturday and a Sunday. So one of them was like a have to take, I think it was the ondansetron. I took both Saturday and Sunday. And the other one was there for in case the ondansetron wasn't strong enough and I was still feeling nauseous, then I was supposed to take the other pill and that. And like I said, I took a couple of the ondansetron, but I really didn't need to. I didn't have the nausea. So that was very nice. Then getting the pump off, that was more where I'd feel it. So from Wednesday to Friday, I was still kind of okay, still having symptoms, but by Friday, once the pump was off, then it was like, woo, stuff hit. So that was either more of a little bit of exhaustion on Fridays, and again, really not wanting to eat. And that was more where I'd feel a little bit more nausea. And then muscle cramping. So not only like the tingles in the fingers of what I was having, my hands were actually cramping. And in fact, one of the times I went to the car, my face cramped, like I yawned, and my face was like ready to freeze up. It was gonna cramp. I'm like, oh. Besides, sometimes also I would feel numb. Again, with the wind and the tingles, if I was outside taking a walk, it would feel like I'd been in a snowstorm, you know, a really windy day, that the face would kind of feel that way, and then the hands and the toes. Like when you're, you know, outside really cold and you come back in and you have to like warm up, get everything kind of back feeling okay. That's the way that felt. On later doses, do I have on here third and fourth? Okay. Yeah, I know by my third treatment, I was feeling the doses, I was feeling the side effects harder. That's the thing too. Once you have side effects, as they say, you're pretty much going to have side effects from that point onward, and they'll probably get worse. So after I had them after the first treatment, I was like, shoot. If I'm already having them now, that means I'm going to have them for every treatment. And if they're going to keep getting worse, I mean, that was part of it too. Like I said, I could handle it now, but if it's going to get worse next time, how much worse? Am I going to be able to handle it then? So after the third treatment, that was like pretty much my like high point, breaking point of like, okay, I can handle this, but this is it. This is kind of tough. And I didn't want it to get any worse. For that third treatment, the oncologist adjusted it for me where I had just the oxaliplatin. He got rid of the leucovorin, and he got rid of what's called the Fluorosil push. So that's that injection they give you right before they get you set up with the pump to send you home. And I know with that treatment, I ended up having symptoms towards the end of that 80 minutes. I already had the tingles going, and the hands and feet wanted to cramp up. And that one, my symptoms were kind of, they were still bad. You know, that was where they were bad. So then by the next treatment, or the fourth one, well, after the third treatment, I mentioned on Facebook how I was having, you know, these bad symptoms. One of my classmates is a nurse, and so she responded that they can lower the dosage of oxaliplatin, and it's the same effectiveness. And so I was like, really? Oh, that is so good to know. That is so, you know, I'd heard they could maybe lower the dosage, but I thought too, and I'm like, well, I don't want to lower the dosage and lower the chance of whatever it's supposed to be doing to making me better, you know? So it's like, I'm going to try to stick it out as much as I can. But when I went in for the fourth treatment and I said, you know, I was getting symptoms at the end of my treatment last time. So he said, okay, we'll lower the oxaliplatin. And I was just like, oh, thank you, thank you. And he goes, well, I'm not lowering it that much. And I'm like, that's okay. Just anything. I'll try it. That'll be great. It's, you know, let's see how that goes. And that was good. For that one, I had just a little bit of the symptoms, and it was okay. It was tolerable. It was almost even a little bit less than my symptoms were the time before. And I thought, wow, that it wasn't going to get worse, because again, I kept thinking, if I'm still going to keep getting worse, and even if you lower the oxaliplatin, it still might be the same or worse. And it actually almost was a little bit better. So, and then it stayed that way for the rest of the treatments. It leveled out. It was there. I was like, oh, thank you, thank you, thank you. So that was awesome. And then again, from this Healthline site online, they had mentioned on there that in a 2018 study, they found that in 109 patients with stage 4 colon cancer, 46% required a dose reduction due to the side effects. So already that's almost half the people that get this kind of need a dose reduction. There was no significant differences in overall survival between people who received an adjusted dose or original dose. I was very grateful that we were able to do that, that my symptoms leveled out, and I was good, and to be able to do the 8 treatments. So we were able to keep going and get that 8 in. So that was awesome. And some of the later doses, some things that also happened to me was I had hair loss. I had hair thinning. I didn't have my hair completely fall out. And in the very beginning, when we even first had our meetings, as far as mentioning side effects, that was not a side effect that was mentioned as far, you know, hair loss. So that was also interesting. Again, not that it would have really mattered. If it would have happened, it would have happened. We talked about, you know, my husband and I talked about, okay, if it happens, you know, what are we going to do? What do you know, we'll shave it, we'll do, so be it. It'll grow back. It's okay. But I didn't ever lose all the hair. I said I just had it thin out a lot. And then I've had it where I do have mostly straight hair. I mentioned this in a different video. Part of that, I have all these scragglies up here, which is part of all the new hairs that are growing in. These are all like short hairs that are all scraggly. That it's kind of coming back in more curly. So again, the outside too, it's more straight, and still kind of is. But I've had, I don't know, it still kind of is or not. When I had my longer hair, you could kind of tell it was more straight, and on the inside it was more curly, and it's still kind of doing that, where it's a little bit still more curly underneath. Probably this is a little bit maybe, you know, shorter in here, and so as it grows more, it's a little more curly. So again, I had heard of that, even when you lose your hair completely or whatever, that as the hair grows back in, if you had straight hair, it'll grow in curly. If you had curly hair, it could grow in straight. when I was at acupuncture, the gentleman that was in there mentioned that his hair was thinning, and he may have wanted, may have been even, you know, losing chunks of it or something, but he said as his hair, he could tell with some of the longer strands that he had areas where it was like colored and then like not colored, and so there were streaks in there. Which I know they've mentioned on like medical shows, you know, CSI type programs, that they talk about hair sometimes when they want you to give a blood sample, or they're finding criminals, trying to find the criminal who did whatever and stuff, and they'll do a hair sample, as opposed to maybe blood or fingerprints or this and that. But if they get a hair sample that in your hair, that things stay in there, or they could tell if you've taken certain types of either narcotics or you're nutritionally deficient, or, you know, same thing, even an area you live in may have, you know, maybe higher in lead or something, and they can tell that in your hair. So yeah, your hair tells a story. So I had that dry skin. I had like 2 patches of dry skin. I didn't get that really all over. I had a dry patch here, which started first on the inside of my eyebrow, which I was just like, really? What the heck, between the eyebrow and the inner eye? And then I got a dry patch along the left side of my nose. Right side was fine, but on the left side I had that. So funny. I had, yeah, that neuropathy where it was the tingles and also almost a little bit numbing, and then the muscle cramping. So, and like massaging didn't help it. My husband would try to massage my legs, and I'm like, it almost felt kind of good massage wise, but it wasn't helping the cramping. It was like, oh, that's the way it goes. So other side effects that can occur that I have heard of it happening to other people are mouth sores. So again, I've not had that happen, but people can have sores on the inside, and there's a certain type of a mouthwash that you can get. They suggest you get to try it to help with that. Red and peeling hands and feet. I did have it where I almost had a couple more, either more calluses, little callousy areas on there, but I didn't have anything peeling, or any of that. My hands, same thing on my foot. I think I had like one tiny spot that was there that seemed to have peeled a little, but it was maybe like a week or two's worth or something. It wasn't something that lasted for me, or it wasn't any big thing. Rash. People have had little pimply rashes on their face, sometimes all over the body, on their chest, on their heads. Bruising. I know when I would go in for my appointments, they would kind of ask, do you have any bruising? Or they would check my hands and my legs and check for swelling. But you could bruise easily. Tightness in the jaw. So again, it was kind of like when I yawn, it was like it almost locked up the one time and stuff. But again, it would only happen once. But I know people have had problems with the jaw, or something when you're chewing, when you're eating, then it can feel really tight or real sore in the jaw, and itchiness. So again, I didn't have that stuff. These were the things that have happened to me. There are support groups out there. I think even through the hospital they have some. They give you some information for some online support groups that you can go to, or looking online, even like through Facebook. I am a member of 2 or 3 colon support groups, and it's very nice on there that they're private groups. So if you don't want anybody, knowing you have this, or you're keeping it private, keeping it quiet, not telling your work people anything. Hey, family members, you can go to these support groups and can have your name on there. You can be anonymous, but you can ask questions. You can see what other people are saying, reporting, and it's so helpful. The people have been so kind. Even if you're just having a bad day and you just need to vent. Like, oh, I'm having a bad day, or I'm feeling really sad. How do people get through this? And the people in the comments are all just so nice, and they're like, hey, you're in the right place. Like, I don't know if I can vent here. I don't know if I can, and they're like, yep, you vent. This is the place for that. We've got you. We've all been there. And I have the tingles just talking about this. That is, they are a good group of people, all the sites. There's lots of people on there that will be like, hey, yeah, I found this to help. They'll give you suggestions, like, try this. Or, different things like, for your ostomy bags or whatever. I'm having trouble with the ostomy bag. What products do you guys use? What have you found that helps? And the side effects. That's where I found, for one of them was saying too, for the neuropathy, to try, they were taking some vitamins. Which is when I started taking, it was the zinc and vitamin B6 And there was another one I never actually got to ordering or taking. And at this moment I'm forgetting what it is, but again, if you go online and you go to these support groups, people will say different things that have been helping them. So good points of support. Also, obviously your doctor. Again, as I'm saying, these are all just the things that have happened to me, and some of the extra stuff that I know have happened to others, or I've read about, heard about other people having to go through this, seen other videos of other people, some of the symptoms they've gone through. And so talk to your doctor. Obviously, you want to talk to your doctor about the medications, whatever side effects you're having. Always let them know so they know where you're at and they can help you as much as they can. If they can lower the dose of medicine, they can do that. Also, that was the other thing I was going to mention. For your blood work, that I said when I'd meet with the doctor and he would check over my blood work and see where it was at, whether I could have a dosage of chemo or not. Again, I'm grateful I was able to make all my 8 doses all right in a row. I didn't have to skip any doses. There was a time where my white blood cell count was low, but it was high enough that he was okay with giving me the treatment. But also then I had to start getting a shot for helping white blood cell growth. So I had to get a shot to help with white blood cell production. So after I would get the pump removed, they would give me a shot. That too had kind of its own little side effects. Sometimes I felt it go in, sometimes I didn't. And I'm trying to think. I have a video on all that too. Having to get the shot. And then the side effects I would have with that. Can't have been much worse than the chemotherapy side effects, because at this moment in time I'm not remembering those side effects. I'd have to go back and check my video. But anyway, so they do have stuff like that also, that they can give you extra medicines. One of the times I was low on potassium, so while I was there I had to take a potassium vitamin. So that too, being aware of, okay, potassium's a thing that they look for and that they really want to be at a certain level and stuff. So I increased my intake of like bananas at home here and mashed potatoes. I think there was a third thing. But I went online, looked up potassium, and it was like, okay, these are foods that are high in potassium. So try to increase those during that whole time. Talk to your oncologist and your medical team, even the nurses. The nurses talk to all the patients and know what they've been doing, what they've been taking, and what helps. So when I talked about trying the Gatorade and the Propel and how that was like a little bit too sweet for me, that I didn't really care for it, one of the nurses said, well, have you tried the Gatorade? I think it was Gatorade. No, Pedialyte. Have I tried the Pedialyte packets? He said he found those to be better than the actual Pedialyte. And so he happened to have some samples there, and he gave me some samples of Pedialyte. So that was awesome. And like I said, when I had that full feeling, and they mentioned too, try the Prilosec. So they've got ideas too. So talk, communicate. It's a big part of all this, the communication, to help them help you. Keep it out there, because again, as you don't know until you know. I didn't know they could lower the dosage of the medicine and stuff until I knew, and then it was like, okay, bring it up to the doctor, and then yeah, they could, and that helped. So that was awesome. Also nutritionist. I know with part of my cancer treatment plan, it was like there were a whole lot of things available to help me. There were psychologists, there were nutritionists, there was the acupuncture and massage, and financial counseling if needed. I think regular counseling. They did have a regular counselor call me at one point, and they talked about doing some like art therapy with me or journaling, and we met for like 2-3 times, and she was like, it seems like you're doing pretty well with it. I said, yeah. And the nurses were concerned about me at one point because I was either crying at the end of one of my appointments or something when I was feeling the symptoms like right there. I think I may have started kind of crying or doing and I was crying during an appointment. I think I came in at one point, maybe I was coming in for a pump removal too. I was just having a day, and I think I was crying at that. My husband would go find a box of tissues for me. I'm like, I don't know why. The tears are just coming. It just is. And so then I had a counselor call me and say, hey, how's it going? Maybe let's try some art therapy. Let's try this like word association therapy stuff where you could do, all right, we tried it. And I'm like, I was just having a day. And you're going to have those, and that's okay too. You got to, cry it out sometimes. That helps. That also, tears release stress hormones, so that helps too. But yep, this is a journey. It's not a sprint. So glad I got through all of that. Like, I've had a ton of support. I nicely had support from all of my family, my friends, from my whole, you know, face group, which mainly my classmates on there and some family. Having, you know, them, my mom and the cousins and all that she keeps in contact with. They're always, you know, calling her, how's Jenny doing? What's going on? So I've had tons of prayers. And then also to my YouTube community, you guys, that when I started my journey and I put it out here just for informational sake, but then I started getting comments from all you guys too, and that you're praying for me and think about me and care for me. So I so appreciate that. That was an unexpected benefit, bonus for me, that I have a whole other community of people that are offering prayers and help, which again, I have tingles all over, which is saying that, yes, that's an awesome thing. And yes, I'm very grateful. I appreciate it so much. And I think about it all the time. And as I've mentioned before, in my nightly prayers, I really do. I you know, go through everybody that that I'm thinking of, and try to get through everybody, and including you guys, that I send my prayers all back to you. Because again, whether it's cancer or something else, everybody's going through their own journey. You may have your own family, you know, stuff with your immediate family, whether you're in-laws, whether you're getting along, not getting along, whether you know, have trouble going on at your job, whether, you know, anything. There's something. And if you're not, that's awesome. But it may only last a long time. And if you start going through something, again, it's okay. It's why a lot of the stuff out there is, you know, just be kind to everybody, because you never know what somebody is going through. We all try to put on our happy face. We don't, you know, because who wants to be around a sad person? Yeah, we'll have our days, but for the most part, we're going to be happy and try to, you know, live life to the fullest, do our stuff, make our memories, and make it as best as we can. So, I hope you guys are all doing well. Again, let me know in the comments what's all going on with you. I like reading all that and feeling a little closer to you and what's going on. So, keep it positive. Go make it a great day. Bye-bye.